Thank you for calling North Valley Medical Center. My name is Lexi, an AI assistant. I'll gather a few quick details and then connect you with the right specialist. Before we begin, this call may be recorded and your information is protected under federal privacy laws. Can I have your full name, please?
Sarah Jones?
To confirm, your full name is Sarah Jones. Is this correct?
That's correct.
Thank you, Sarah Jones. For security, please provide your date of birth.
It's March 12th, 1978.
Thank you. To confirm your identity, please provide the last four digits of your Social Security number or your patient ID.
It's 4592.
Thank you. I've verified your account. How can I assist you today?
I have a procedure scheduled next week and I need to know if my insurance is covering it. I also might need to reschedule.
I understand. I see you have an endoscopy scheduled for Wednesday at 2 p.m. with Dr. Patel. Are you calling about coverage, rescheduling, or both?
Both?
I'll gather a few details so our specialist can assist you quickly. First, are you planning to reschedule due to availability or due to cost concerns?
Due to cost concerns, I don't know what I'm going to owe.
I'm transferring you to a patient financial services specialist who can review your estimated responsibility and confirm authorization status.
Hi, this is Alex in Patient Financial Services. I understand you're calling about your upcoming endoscopy, concerns about insurance coverage and possibly rescheduling. Is that correct?
Yes, I don't want a surprise bill.
I completely understand. Let me walk you through what I'm seeing so you have some clarity. Your insurance plan has a $1,850 deductible remaining. That means the first $1,850 of the procedure cost would be your responsibility before your insurance begins paying.
And what is a health insurance deductible?
A deductible is the amount that you must pay out of pocket for covered healthcare services before your insurance begins to pay. Once that deductible is met, your insurance plan starts sharing the costs according to the plan benefits. Now, after the deductible is met, your insurance covers 80% and you would be responsible for 20% co-insurance. So for this procedure, the average allowed amount ranges between $2,500 and $3,200. That means your total responsibility would be approximately between 2,200 and 2,500, depending on final billing.
So I have to pay the whole amount?
Possibly, depending on the final billed amount. After your deductible is met, your insurance covers 80% and you would be responsible for 20% of the co-insurance.
That's more than I expected.
I understand it can be overwhelming. Setting up a payment plan or exploring financial assistance can really help ease that burden. Would you like me to proceed with checking out these options for you?
Yeah, that helps.
I also see that prior authorization is required by your insurance. It's currently pending review. We typically receive a determination between 3 to 5 business days.
What if it's denied?
If it's denied, your physician's office can submit additional documentation or request a peer-to-peer review. We handle that coordination on your behalf, so you're not navigating it alone.
And if I reschedule, does that affect the authorization?
Good question. The authorization is typically tied to the procedure code and provider, not the date, as long as it's within the approval window. So rescheduling the next 2 weeks shouldn't impact it.
This is just stressful.
Yeah, I understand. Medical billing can feel overwhelming, but my goal here is to make sure you know exactly what to expect before anything happens. Would it help if I sent you a written estimate and breakdown via email?
Yes, please, that would help.
I'll send that estimate now. Would you like to keep the Wednesday appointment window while we wait for authorization?
Yes, let's keep it.
I've sent the written estimate to your email. You should receive it within the next few minutes. It includes the deductible remaining, your projected co-insurance, and the payment plan option.
Okay, thank you.
We'll continue monitoring the prior authorization request. If we receive approval or need any additional information, we'll contact you right away.
All right.
All right, we're all set for now. We'll reach out as soon as we have an update on the authorization. Take care.
Thank you. So these are the insights for the call that we just did. We can completely configure and customize these insights based on the requirement of the user. Right now, we had the call where a patient had an issue with the cost coverage and they made a call. And as you can see, a supervisor can come and see if the human agent appropriately answered that call. So out of a total 10 sessions, in 7 of those sessions, coverage was verified. In only 2 of those, coinsurance and deductible were explained. 6 of them confirmed the appointment. And again, these smart list check items are completely configurable. So based on the requirement of the user, we can configure these. Similarly, these insights are also configurable. You want to capture something that is useful to you, you could completely do that. So whether you want to check for customer satisfaction or sentiment, you could do that here. We also have all of the calls stored here. So the supervisor can actually go ahead and check the transcriptions of the calls. They can listen to the audio of the calls. We also have an entire summary here that we also saw at the end of the Genesis call. What items from the checklist were checked is also present. So for the last call that we did, all of the checklist items were present and they were checked by the human agent. So the supervisor can check if the agent is performing as required. The entire summary comes up here as well. And the summary, again, the template for the summary is customizable. The user can decide what things are relevant to them to be displayed. So it's completely customizable as well. And yes, insights and analytics are all customizable based on the requirements, and it gives the supervisor a really nice idea of what needs to be changed or what human agent needs to be given certain directions.